Now, let's move to a second famous type of IDD, endemic criticism. So what is endemic criticism? It's a very severe form of brain damage in fetus and infant due to iodine deficiency. And it's marked by permanent mental retardation and other developmental defects such as deaf mutism, short stature, and muscle spasticity. Endemic criticism is a more serious manifestation of IDD. It can be summarized as short, deaf, dumb, and paralysis in the symptoms. So the pathogenesis of criticism from embryo to fetus at 3 months are due to inadequate supply of iodine. Fetus are short for thyroid hormones, resulting in impairment in fetal growth and causing developmental disorders. In particular, the inhibition of central nerve system development and differentiation. So, in the embryo, if the iodine supply was inadequate, there will be a poor differentiation of the embryonic period of brain development, causing deafness, language barriers, and the upper motor neuron disorders, as well as mental retardation. On the other hand, up to 2 years after birth, if there is insufficient iodine uptake and also insufficient thyroid hormone synthesis, they will significantly affect the body's and bone growth, resulting in a small physical and sexual retardation, myxedema, and hypothyroidism symptoms. So there are 3 types of criticism. The first one is the nervous type. The nervous type is mainly on the mental deficiency, including the deaf-mute, the neurological movement disorder, and the symptoms of hypothyroidism. And the second type is the muscus type, with a severe hypothyroidism symptoms, growth retardation, and dwarf. So basically, the muscus type is more from the looking or from the growth that we can see that the children look shorter than the ones that have normal intake of the iodine. And the hybrid one, or the hybrid type, is a combination of the characteristics of the 2 types, the nervous type and also the muscus type. So they have the both the neural symptoms, including those mental deficiency, but also from the outlooking, they look smaller and with growth retardation. In this hybrid type, some of them are men neutral type and some of them are men muscus type. So there are some subtypes in the hybrid type. And the symptoms and signs of the criticism are, first of all, mental retardation due to the impairment in CNS formation or development. And the second one is deaf and dumb, also because the reduced or impairment in neuron development. Also neurological dysfunction, growth retardation, hypothyroidism, and goiter. So 1, 2, 3, 4, 5, 6. These 6 are the main symptoms and signs of criticism. As we can see from this picture, this child looks quite normal from the face, but as we can see from the patient's legs, it's actually not very normal. And also, this is a type of neurological type of the criticism. And this is also another criticism patient. As we can see from the face, these faces, they have a looking of smaller nose and larger distance in between the eyes. This kind of face is sometimes accompanied by the dull or numbness of the patient. Also like this, as we can see, the distance between the eyes are longer than normal people, and also have a smaller nose, and the mouth looks like this. And also, this is actually it's actually the twins. But this one is a lot shorter than that one, so it's the shorter status. And also this one. So the diagnosis of endemic criticism is, first of all, the prerequisite is that the patient has to be born and lived in iodine deficient area. And the second one is that patient has mental retardation, with mainly manifested by varying intelligence quotient, so IQ. And also there are some other auxiliary conditions like nervous system symptoms and symptoms of hypothyroidism that can be used for accelerating the supplemental to the diagnosis criteria. So how to prevent IDD, and what's the treatment principle of IDD? First of all, how to prevent? In China, we have a policy that all the salts are iodized. So salt ionization is preferred. It's a preferred method for preventing iodine deficiency disorder because it's very easy. We just need to add iodine into the salt, and because people cook, so people can eat with the food with a salt containing iodine, and this way we can easily supplement with enough iodine. If this iodized salt is not easy to be used, we can also use lipoidol, which is the iodized walnut oil or soybean oil. And this kind of oil can be both intaked by intramuscular injection or by oral intake. This lipodol are very good for prevention because those lipodol with intramuscular injection, they contain in lipid form. So they will be slowly released to the human body, and one inject normally lasts for 2 to 3 years. So it's very convenient for someone that has difficult to access to enough iodine. Also, there are other methods for prevention, like oral potassium iodine tablet, iodized bread, iodized water, and eating more iodine-rich seaweed, fish, and other stuff. But what if we have already had the iodine deficiency? We need to treat it, right? So for endemic goiter, first of all, we need to treat with a thyroid hormone. So we need to prepare the patient with enough thyroid. We can use that by we can accomplish this thyroid hormone therapy by using the thyroid preparation powders, for example, from the goat. In Tibet and some very mountainous areas or hills, we know that the iodine are not enough in the environment of these places. So people are really easy to get iodine deficiency. And from the goat's thyroid, we can take the, actually there are people who took the goat's thyroid and then grind it into the powder where the thyroid contains a lot of iodine. So those people just intake the goat's thyroid powder to increase their iodine content in their body. Secondly, sometimes we need to do some surgical therapy because, as we just mentioned, that in some of the goiter, the enlargement of thyroid suppress the surrounding tissues, causing some compression symptoms. So we need to cut the enlargement parts by surgery. For endemic criticism, the treatment is the sooner the better, because we all know that during very early developmental stage, the sooner we can stop this iodine deficiency, the more there's more possibility that the children or the child can be rescued by the short, death, paralysis, and dumb symptoms, right? And as long as the treatment, the therapy was done, they can quickly receive the desired therapeutic effect. Also, we can have some auxiliary drugs like vitamins or trace elements and brain tissue preparations for supportive treatment or supportive therapy.